Hello. I did not make my slides in any particular order or going along with my speech, so I'm probably going to go through all the questions first. These are really most questions that I get from patients on a daily basis, and then I'll talk a little about GYN cancers and then the prostate, which I don't treat men, but it's okay. I will discuss the prostate anyway. So, first is, how do you screen for ovarian cancer? Oh, wait, I got to start the thing. There we go. I have to put my thing into? Oh, we're done. Okay. So the correct answer is A. Only 10% of you got that. There's actually no screening test for ovarian cancer. Ovarian cancer, they keep looking for a screening test, but there is no actual screening test. We try and do CA 125 levels and transvaginal ultrasounds on high-risk people, but it is also not a good screening test. They're trying to look for other variables that will help, like cancer screening indexes and symptom indexes that will help people get diagnosed earlier. But in general, ovarian cancer is diagnosed in its later stages. Okay, next question. How often do you need a pap smear? These guidelines also have changed relatively recently. Oh, sorry. Wait, there we go. So it sort of depends on your age and whatever, but I'll talk about that in a second after you guys all answer. All right, the answer is actually, I don't know. How do you get the answer up? Oh, I have to hit it. Sorry. 40% you are right every 3 years. So the screening guidelines are different from people under 30 to people over 30. If you're under 30, you generally get just a pap smear. If you're over 30, you get a pap smear and a HPV test. Yes. A pap smear is a screening test for cervical cancer. There are very few tests that we can actually do to screen for cancer. The other lovely doctors have discussed two of the other ones we can do, mammograms and colonoscopies and endoscopies. So pap smears is another one that we actually have a good screening test for. So pap smears are looking for only cervical cancer. The most common types of cancer of the female genital tract are ovarian, endometrial, which is of the body of the uterus, and cervical. And cervical is the only one we actually have a screening test for. The recommendations for people for pap smears is generally every 3 years from 30 to 65, providing you had a normal pap smear, and they generally stop having pap smears at 65. I don't stop doing pap smears at 65 if you're changing sexual partners or if you have had prior abnormal pap smears in the past. All right, how often do you have to see the doctor if you are in menopause? Menopause, oh, I'll tell you that in a second. The answer is every year. That's correct. Even though the guidelines change about screening, you still should come to the doctor every year. We still have benefits to discuss with you about health and depression and weight and blood pressure and sometimes other life factors. So you should come to see the doctor every year, even if you don't have your period, even if you're not getting a pap smear. When should you get genetic testing? So both the other doctors also discussed this a little bit about people getting genetic testing, but these are questions I get every day, all day long. So these are the questions that I am bringing to you. We're getting very slow responses on this one. I think I've stumped everybody. All right, so the answer is D. So obviously, if you have no family history, you don't need to get genetic testing. You guys did well on this. If you are Ashkenazi Jewish, it is, but only if you have a family history and you're Ashkenazi Jewish. Having your mother have breast cancer at 65 itself is not a risk of familial cancer. And if you had an aunt having ovarian cancer at 45, anybody under 50 is considered to increase your family history risk. Yes?
What does being Jewish have to do anything?
So Ashkenazi Jews, who are people from Eastern Europe, have a much higher rate of many cancers than the general population. Probably because of generations of, I don't want to say inbreeding, but no, I mean, they were in ghettos, so they married each other, inside the same cousins, and it was the same genetic pool over and over again for generations, and so mutations occurred that never got spread out into the population, and so many mutations for also people who are trying to get pregnant, and we're looking at genetic, not precancerous genetic conditions, but just genetic conditions that can cause birth defects and stuff like that are also much higher in the Ashkenazi Jewish population. That's an excellent question. All right, so another for the younger people. I get this question all the time. What test can you do to make sure I will have a healthy baby? All right, the answer for the majority is correct. There are no tests to check to see whether or not you can have a healthy baby. I get this question many times all day long. It would be very nice if we had a test to check whether or not you could have a healthy baby, but we do not have a test to check to whether or not you can have a healthy baby. So basically you have to try and get pregnant and have a baby and try and see if it's healthy. All right, also another question I get. How do you know if you should start thinking about freezing your eggs? No one has any idea what freezing eggs means? Doesn't look like there's many egg freezers in this room. But anyway, so you are correct. There is no specific time or timing for egg freezing. It's very popular now in New York for women who are getting older and still have not had children. Egg freezing is now a technology that's available that you can freeze your eggs sometime in your 30s and still have babies well into your 40s by carrying your 32-year-old egg. It has a much higher chance of having a good pregnancy than a 45-year-old egg. Okay, on to the next one. How do you know if you are in menopause? Okay. And you guys are right. You have not gotten your period for over 1 year. That's a clinical definition of menopause. It can happen anytime between the ages of 43 and my oldest patient who had yearly periods was 64. It's a long time. Just as a general population for obviously the women in the audience, have you had a pap smear in the past year? Yes or no? Oh, sorry, I hit that too fast. Oh, it's a lot of no's. All right, all you people should be visiting your gynecologist. You need to have your pap smears done. Okay, what do you do if you have bleeding after menopause? I'm sure there's a few menopausal ladies in this room. Okay. Go see your doctor immediately. You are a very wise group. That is correct. Go see your doctor immediately. Even a small amount of blood, any blood, is not normal. Just comes, you got to go see your doctor. Anytime that you are, I usually say 9 months. If you haven't had your period in 9 months and you start bleeding, you need to go see your doctor. And then a few quick questions about fibroids, because everybody has questions about fibroids. What are fibroids? Okay, that's correct. 86% are right. Benign tumors in your uterus. Correct. How common are fibroids? You also, it's a very smart crowd today. Up to 70% of women have fibroids. Some are big, some are small, so not all of them need treatment. So I'm going to give a few minutes just on female cancers, and then we'll talk about the prostate to involve all the men in the room. So uterine cancer is the most common GYN malignancy in the United States. It affects 2.6% of women lifetime, and the average age of diagnosis is about 61. The majority of women are diagnosed at an early stage. Uterine cancer often presents with bleeding, abnormal bleeding if you're under the age of menopause, or postmenopausal bleeding after menopause. The most common risk factors are extra estrogen in your system. Extra estrogen comes from being overweight. It can come from having estrogen therapy without having progesterone therapy. It can come from tamoxifen therapy that is given when you have breast cancer or trying to decrease your risk from breast cancer. Having diabetes increases your risk. Not having any children increases your risk. High blood pressure increases your risk. The good news is it's relatively easy to treat with surgery. It is often in an early stage, and so the 5-year survival rate for stage 1 cancer, which is 80 to 90%, which is excellent. The evaluation for that includes an ultrasound and a biopsy of the lining of uterus, which is done in the office. So it's a relatively easy cancer to diagnose, and if you catch it early, then treat. Ovarian cancer is the second most common GYN malignancy, but it's the most common cause of death among women for GYN cancer, because it gets diagnosed very late. There are no real symptoms. There's no real screening testing. Basically, they keep looking for more ways to screen for ovarian cancer, and so far we have not been able to find accurate tests with what we call a positive predictive value, meaning if you have a yes on this test, you have a good chance of having ovarian cancer. If you have a no on this test, you have a good chance of not having ovarian cancer. So some of the symptoms that people present with is either pain, increasing belly size, early feeling full early. They're all very nonspecific symptoms that usually the gastroenterologist sees. But they are common with ovarian cancers. And so if your GI symptoms are lasting longer than you think they should, or are more severe than you think you should go to the gynecologist to get an ultrasound to try and rule out ovarian cancer. The strongest known risk factor for ovarian cancer is a family history. There are Lynch syndromes and BRCA genes that people have heard of that does increase your risk, although they do occur rarely. Most ovarian cancers are sporadic, meaning it's just the general population of whoever gets it. But if you do have a family history, you're at much higher risk for getting ovarian cancer. And then treatment is surgical and chemotherapy. Uterine cancer which I just talked about. And then there's cervical cancer. Luckily, we do have testing for cervical cancer that is pap smears. And like I said, we should screen every 3 years if they're normal. The lifetime risk of developing cervical cancer is less than 1%, and the average age is about 48. HPV is directly related, so the younger ones here should have gotten HPV shots. The vaccine has been developed, and now there's actually a new vaccine that covers more HPV viruses, about 14 high-risk types. We only screen for the high-risk types because we don't really care about the low-risk types. They don't cause cancer. The high-risk types, the first vaccine came out, covered 2 high-risk types and 2 low-risk types. The new vaccine covers 7 high-risk types out of the 14, which is much better. 99.7% of cervical cancers have HPV in them. And most of them are this type 16-18, which all the vaccines have protection against. And the risk factors for cervical cancer are sexual activity, multiple sexual partners, high-risk sexual partners, history of sexually transmitted diseases, cigarette smoking and being immunosuppressed. Basically, it's the detection is through pap smears. So it's rare that you have a cervical cancer that is not detectable on pap smears. And so treatment is generally surgery and potentially radiation if you need it. So on to prostate cancer, which I don't see any patients with prostate cancer because I don't see any patients with prostates because it's only in men. But here are some questions about prostate cancer. What is the second most common cancer in men? That's correct, it's prostate cancer. Excellent, that's the title of my talk. The most common is lung cancer. What is the strongest factor to increase your chance of getting prostate cancer? Nope, it's actually just A. C is important, but A is the most important. Age is the most important. Prostate cancer is, like I said, the second most prevalent cancer in men worldwide, and it ranges from having precancerous cells to having an aggressive type of cancer. The lifetime risk for an American male of getting prostate cancer is 16%, but the risk of dying is less than 3%. So prostate cancer is also screening. There's screening available for them, and when prostate cancer is detected, 30% of men at age 55, but 60% of men by age 80. So it does increase as you get older. How can you tell if you have prostate cancer? Oh, whoops. Oh, I don't know. I got 0. I think I probably did this wrong. Okay, well, the answer is D. There's no perfect test for looking for prostate cancer. The frequency of the diagnosis of prostate cancer has increased because they have something called a PSA test, which is a prostate-specific antigen screening. So you get that at your doctor, and they also do a digital rectal exam to feel for masses. If the prostate cancer is found early, it has a 100% survival rate, as opposed to if you wait until it has spread and you don't go to the doctor, it's about 30%. What are the risks for testing for prostate cancer? So like every other specialty of surgery, including breast cancer and cervical cancer and prostate cancer, there's always controversies about how often you should test. And just like mammograms, how often you should have mammograms, and pap smears, how often you should have pap smears. It also relates to the prostate, what are the risks of testing for the prostate cancer? What do you think would be potential problems? All of the above. That is correct. So, just like anything else, a problem with screening is overdiagnosing, overtesting. So it becomes a discussion with your physician as to what you want to do, but the answer is all of the above. And when should you start testing for prostate cancer? Oh, sorry, didn't hit the right button. 80% of men are currently diagnosed with prostate cancer because they undergo a biopsy after having an elevated PSA test, which is run by their doctor. So the higher the PSA level, the greater the chance that the biopsy is going to come back positive for cancer. The answer is all of the above. That is also correct. Basically, the treatment for prostate cancer can be surgical, it can be medical, there's some medical therapies. There's also sort of a watch and wait. If your biopsy comes back with a slow-growing prostate cancer, there is some thought to just watching and waiting because cancer surgery can cause, I think one of the slides, it can cause urinary issues, it can cause sexual performance issues, so some people do not want to have surgery on their prostate. What do I have next? So basically, healthcare providers discuss prostate cancer screening with men who, again, will live at least 10 years past their age that they are, and it should start around age 50. It should start earlier, age 45 to 50, in men at high risk for prostate cancer, including Black men and men with a family history of prostate cancer, men who have relatives younger than 65 who had prostate cancer, or who are at risk or known to have BRCA mutations. Then I have just 2 slides on BPH, which is benign prostatic hypertrophy. Somehow it didn't come off on my thing. But anyway, basically that's a condition that men get when their prostate, they don't have cancer, but it gets enlarged. And it affects quite a few men. Obviously, it increases as you get older. It can cause some symptomatic issues. Sorry. And the answer is B, correct, for the few men who answered in the group. Anyway, so that is also something that is involved with the prostate, and that's it. My talk is over.